Hi everyone, Dr. Remy from Pain Free and Fit. Today, an advanced exercise for spondylolisthesis targeting your upper body training known as the dive bomber. Hope you enjoy. So many of my patients with lower back spondylolisthesis are looking for advanced exercises to challenge their neutral spine, particularly during training upper body. The dive bomber is a great body weight exercise to allow you to do such. Remember that this is not a beginner's exercise. Once you've learned what your RPI, reverse posture isometric, is and how to hold your neutral spine to protect your spondylolisthesis and train through some beginner and intermediate exercises, then and only then should you try the dive bomber, because the dive bomber challenges your ability to resist excessive extension or arching of the lower back, which typically aggravates spondylo because it mechanically drives that vertebra forward, aggravating many cases of spondylolisthesis pain. The idea that we are advancing as our home rehabilitation or home self-skills exercise, healing exercise program continues, is our ability to take ourselves out of holding a strict neutral locked spine with no motion and actually allowing some extension. The key is just making sure you're not overextending, aggravating your symptoms. Again, when we've had previous videos on this channel explaining how to determine a neutral spine, one of the things we've talked about is pelvic tilting. Anterior tilting, where the tailbone comes up and the pubic bone goes down, and posterior pelvic tilting, where the pubic bone comes up, the tailbone goes under, flattening the lower back. That typically is going to be a safer position for most cases of lower back spondylolisthesis, and anterior tilting many times will aggravate pain. However, there's a point in anterior pelvic tilting where you do have some motion, you have some increase in the curve of the back before you jam the facet joints together, compress the posterior back portion of the disc, and create spondylolisthesis symptoms. So it's just learning how much extension you can do without aggravating pain. And that may change from day to day based on postural changes, based on your diet and exercise, the hydration of the disc, barometric pressure changes, the workouts that you've done before or after, the sleep positions you've been in. There's a whole bunch of variables that change the mechanics of just how much motion you're going to have in your back at any given moment. So before you do this exercise or any, and you engage your reverse posture isometric, putting your spine in neutral spine position so it's safe and you have all your stabilizing muscles correctly engaged. For me, I want to focus on my left multifidus muscle, and I want to emphasize on keeping my left hip down and my left rib up so I'm not hip hiking on that left side. So as we do that, we're going to assume a hands and knee position and practice how much extension or anterior pelvic tilting we can do. And we can rock back and forth. We can raise the tail up to increase the curve in the lower back, and we can tuck the tail under. And I just want to explore what range of motion I have that's comfortable in my back, particularly in extension or raising tail up. Once I've determined how much I can do that's pain-free and I engage my RPI, I'm going to get into a piked position where I have my hips higher than my shoulders slightly, and I'm going to approach the dive bomber by moving forward and down in a arc-like motion. And then once my chest comes to where my hands are, this is where extension starts taking effect. So if as I come up in the top of the dive bomber, I overextend my lower back, I'm going to hurt myself. But if I keep tail under an abdominal crunch and allow just a little extension that I've already determined how much that is before, and then come up, I'm going to protect my lower back from being irritated. That's the full extended position. So at this position, if I don't have a little tail under an abdominal crunch down tension, I'm going to be overextending my lower back, aggravating symptoms. But if I have my tail under an abdominal tension, holding that range of motion that's pain-free that I've determined before, then I'm going to be okay, and I'm learning how to extend my mid-back, because my mid-back is actually extending or bending backwards, as well as my neck a little bit. My hips are extending a bit at the hip joint, but I'm not overextending my low back. From here, I reverse the motion, again monitoring and making sure I'm keeping that tail under an abdominal tension, and I come back through the same arc to complete the rep. So we're going to go back and forth in a dive bomber, emphasizing tail under abdominal tension. Sometimes after a rep or two, you may not be sure, you may feel your lower back. Go back to the normal hands and knee position and go through, cycle through again, tail up, tail under, and figure out how much extension you have. You can memorize that even in the pike position, And then you're going to use that by keeping abdominal and pubic bone, lower rib tension on, so that the pubic bone and the lower ribs are approximating each other. They're allowing some extension, but not an overextension. And I come through my dive bomber being conscious of those positions. For me, again, my RPI, I'm going to focus on all my points. My left multifidus is on. My left side is open, hip and rib, not hip hiking, not leaning to the left. Pause for a moment at the end. That trains the spine to extend with a pretty heavy upper body exercise. Dive bombers hit lower pec, mid pec, upper pec, shoulders, tries. Great upper body exercise while learning to extend different parts of your body like mid back, hips. Slight extension of the lower back, but within a tolerable range, so you learn how to extend your body without overextending the lower back and aggravating spondylolisthesis pain. If you like this video on upper body training, advanced exercises for spondylolisthesis, subscribe to our channel. We've got a lot of great videos out there. Questions or comments, write in. As always, I'll do my best to answer them. And if you're looking for a great program to figure out how to develop a healing exercise program for yourself, how to condition neutral spine RPI, protect your spondylolisthesis, get back into shape without hurting yourself, get active again despite your spondylolisthesis condition, check out our fast track program available at the painfreeandfit.com website. I hope you enjoyed this video on dive bombers and spondylolisthesis pain to help with your chronic lower back spondylolisthesis issues.